Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good day. Welcome to Ethical Perspectives on the News. My name is Leon Tabak. I will moderate our conversation today. Our topic is, how will we respond to the next pandemic? Today we have to help us with this three guests, Dr. Christine Petersen, Dr. Nafissa Egbounye, and Laura Behrens. We're going to try to focus our conversation today on communication. So one of our challenges is to invite experts of different kinds to inform the public and to inform the people in public office who make the decisions about how we will respond to public health emergencies. Now, Laura is a writer and an editor, now retired. She had a business in Cedar Rapids called Red Pen Communications. I met her at a meeting of technical writers in our community. And in one of those meetings, she presented a talk on how the Mayo Clinics prepares its written materials for patients. This interested me very much. I thought she did a great job. The clinics have a special challenge in that, of course, these patients are anxious. They're facing emergencies in their own lives, their families' lives. They come from all over the world. They may not know English very well. And of course, the guidance the medical staff gives them has to be accurate. The stakes are high if the communication is not good. So that's my reason for inviting Laura. I'm expecting great contributions from her. And Dr. Nafissa Egbounye is the public health director. Did I get that title right? She'll tell us in a moment, in Black Hawk County. So she has responsibility in the area of public health. And Christine Petersen is a professor at the University of Iowa with some expertise on infectious disease. So we have some technical experts in medicine and public health, and a person with experience and expertise in communication. Let me ask each of you to elaborate that a little bit more. Say something about your interest in our topic, and maybe more about your background that will help our audience in this conversation. Who would like to go first? Professor Petersen, would you like to begin here?
Sure. Thank you so much for having me. So it's been a fascinating couple of years, and I have probably done more media relations in the last 2 years than I have ever in my career. But that said, I would say I cut my teeth on communicating, especially to lay audiences, because I'm also a veterinarian. So it was those experiences sitting in rooms trying to explain perhaps somewhat complicated medical problems of their pet to people that helped me remember some of the basic lessons of how to best communicate and to use stories versus too much data.
Right. And Dr. Egbounye, can you tell us a little bit about what your role is there in Black Hawk County, and again, some of your background and interest in this subject here?
Thank you. Thank you for having me. So I'm the health director for Black Hawk County. Been in my position for about 5.5 years. And it's been just a great journey. My interest in public health communication stems from different components, in particular, the different demographic populations that we're serving and how to reach them. I think that's one of the most important aspect of communication, is ensuring that you're reaching your population and they're getting the most accurate information, and they're getting the information that is that they can absorb, right? So it's not just where you're just releasing information, but is it resonating with them and speaks to them? I think that's one of the greatest things that the COVID-19 pandemic has taught us.
Okay. And Laura, what else should our audience know about your background and interests here?
Well, I spent about the first third of my career as a working journalist, and the second third of my career doing research on journalism and media generally. And then the last third in more diverse editorial pursuits. And I was mainly a lay observer as the pandemic hit about the time I retired. So my interests were colored, certainly, by my professional experience, but I was mostly just another American trying to figure out what was going on, and have been watching and listening as such ever since.
Okay, I'm a little anxious in this conversation because there's so much passion associated with it. So let me ask the question I think might be the most controversial here. I was moved to propose this subject to our producers when I discovered that many people were completely unaware of a point of view I thought was very important. There were a group of professors, three, one from Stanford, one from Harvard, one from Oxford, who produced a statement called the Great Barrington Declaration that argued for a different kind of response to this epidemic. Now, in the journals and the blogs and so on that I read, they're very visible. But I found even people in the medical profession had never heard of this statement. I was dismayed as well to find some leaders in public health trying to dismiss them as cranks, to exclude them from the conversation. So that's my most controversial comment, I hope, for the night. I wonder if any of you have a response to that. Are you familiar with this statement? Are you familiar with the response to the statement? What can you tell us there?
Well, I did read the statement. Yeah, I'll dive in and y'all can throw darts in a minute. But I did read the statement, and I read some of the early response to it. And I think all of it has value. None of it is complete or provides any particular panacea. The thing that struck me most in reading it, and it's now roughly a year old, is that it's dated. Its point of view and the actions that it advocated are based on what we knew about the coronavirus, SARS-CoV-2 then, but we know more about it now. And the actions they suggest are probably not appropriate in light of what we know now. Much of what they proposed was based on the notion that young children were not particularly susceptible to the Delta variant, which was prevalent when it was written. This is before Omicron happened, and that much more infectious strain became more prevalent throughout the United States and indeed the world. I think that highlights the fact that part of the difficulty in communicating throughout this pandemic has been that the information is always changing. And we, of course, want a situation in which we know where we are and it won't change. We can be certain about the information we have. And that is just not the reality of this pandemic. And it's hard for people to deal with, and it requires communications that are both strategic and very, very agile tactically.
Anyone else want to dive in on this one?
Well, I certainly agree that the Great Barrington Declaration makes some assumptions about who is susceptible and who is going to be protected, kind of using wide swaths of age as the main factor. But we know that there's certainly other factors that lead people to be susceptible, including diabetes, including other immunocompromised situations. And I think one of the, to kind of maybe take this a different direction, but
Sure.
I think one of the biggest problems is that this keeps it very positioned in the individual. and that each individual's risk is what really matters, and not a community trying to take into account those who are at risk and try to protect them. And with any infectious disease, and especially as we move into Omicron or now with BA2, when you have something that's going to infect multiple people through a route that's, the open air, to ignore those around you who might be at risk and you may not realize it, I think is at risk, at a fault as a society.
Well, you both responded in part by taking issue with the particular claims made in the statement. And I'm more interested in our readiness to allow a variety of voices to make their case publicly without disparaging them. So these professors were people with decades of experience, hundreds of articles published among them in leading journals, appointments on the faculties of leading universities. And I saw some, what I thought were efforts to exclude them, to brand them as on the fringe and so on, to exclude them from the discussion. And we could also talk about people who don't have these credentials, who wanted to speculate about medicines that might be used to treat this illness. And some of these were cranks, but some of these improbable hypotheses might have some value in the long run. So I'm interested in how we strike the balance in correcting statements that are unfounded, that might be misleading or even dangerous, while making sure we don't exclude opinions, voices, suggestions that might in the long run prove helpful. Anybody want to comment on that one? Okay.
I can go ahead. I think for us, one of the things that we've learned with our communication is the importance of resonating with people, right?
Mm-hmm.
So it's important not to dismiss people's concerns or the recommendations that they've heard, whether it be culturally or scientifically different. I think it's so important because when you at least listen, you're also telling them how much you value them. You value how they're thinking, what their concerns are, and it opens up a room for more dialogue, right? So, an example, we were learning that there are different remedies that were being shared in the immigrant and refugee communities. And I knew one of them because I'm originally West African. And it's this ginger honey like drink, right? And so, but I was able to help individuals understand that, yes, I understand that you have this remedy from home and this is only going to soothe the symptoms, but this is a virus and here's why this remedy is not a cure. So I think it's also important for us to create space to listen to people, even if you're thinking, what they're hearing is not true, is not accurate. Give them that space and opportunity to express, whether it's their beliefs, whether it's just, the things that they value, so that you can at least create that alignment in terms of, why they need to move into a different direction. So I think it's very similar to a lot of the information overload and mix information, false information from different sources. I think for us to shut the door and not listen to what people are saying is actually more problematic.
Okay. Anything more to say on this? So how about this? The public lives in the age of instant communication. We all live in the instant communication age. We expect immediate answers, and I think many naively expect scientists to speak with absolute certainty and perfect precision. And so I wonder if you can comment how people with expertise in medicine, in medical science, in public health, and so on, can speak to the public, retain the confidence of the public, and still concede that some ideas are not yet certain, that there's some margin of error in estimates and so on. What about that? Maintaining the confidence of the public while acknowledging that we don't have all of the answers yet and so on.
So I think Dr. Egbounye did a great job kind of setting the stage for how best to do this. And it's reaching out to people where they are, understanding or at least accepting the unknowns and the fears, and not assuming that they won't understand. I think one of the problems I've seen locally is the assumption that complexity is hard and people don't want to even try. And I think if you set up the complexity in the right way, it can be seen as something that's interesting instead of hard. and that's the real challenge, is to make it something that's interesting instead of complicated.
Okay.
I think too that well, I know that at least some important members of the scientific community were completely blindsided by the early and staunch resistance to scientific information, particularly as it relates to the vaccine. I heard Dr. Francis Collins speak recently, and he was at the beginning of the pandemic and until January of this year, the head of the National Institutes of Health. And he said they were, at the NIH, totally blindsided by the notion that the response to a pandemic could be political, could engender any real opposition. And so they weren't prepared to communicate, I don't want to say defensively, I don't like the connotation of that word, but to prepare for the possibility of a skeptical, if not hostile, audience. They were really thinking that this would kind of be like in the pattern of the polio vaccine or flu vaccines or other major advancements in keeping people safe through the use of modern medicine. And so you heard experts of all stripes early in the pandemic kind of stumbling and racing to keep up. What you didn't hear was, as much as I think was called for, the prefacing statement of, this is very new. We are still learning. What we know today is that could change tomorrow. And to have that beginning, middle, and end of every public statement. Those things were said, but they got lost. They needed to be said more clearly, more prominently, and more repetitively in self-defense, if nothing else, by the scientific and the medical community.
And I want to add to that. I think what you just laid out beautifully is also the disconnect of our systems, right? Of, research into practice. What can come out of research isn't perhaps rolled out the best way in practice. Mm-hmm. And so even language, of how language is used, whether it's at the state or federal level, at times we're saying this isn't going to work for our community. Mm-hmm. Give us different materials, give us different languages, give us different videos, right? And so I think it's also why how it's important moving forward that there's really this strong partnership between the scientific field, as it relates to research, the academic, and also in practice. And for us to have a common language and framework of how we approach or disseminate information, because that really has highlighted also the disconnect.
Okay.
And it can't be ignored that disconnect was certainly exacerbated, if not in large measure caused, by the fact that the chief executive of the land, who was the boss of the FDA head and the Centers for Disease Control head and the NIH head and many, many other agency heads, was actively working counter to their efforts. Whether maliciously or not, that was a huge impediment to effective communications for the first year or so of the pandemic.
And then with that, I think we needed to talk about what was completely changing and we didn't know. But when it came to the vaccine, I think we needed to more clearly make it the case that we weren't going to use the population as guinea pigs. And this was work that started in 2003 with the first SARS. And that the vaccine construct, although, the way it's been put together and given out, was something that was developed for SARS-CoV-2 in the last 2 years. It wasn't something that we just, took off from that point and moved forward, but it had been based on decades of work. It's astounding, given all the people at FDA and otherwise that were working on Operation Warp Speed, building all the supply chains, that we didn't also have the Madison Avenue approach of how are we going to really make this something that's of interest and desired by the public. And I think that's one of the places where, we got lost in our ivory towers and thought, well, everybody wants this, not realizing how much a certain portion of the population, because of other changes in perception around things like vaccines, was primed to not want to uptake it. I think it's those awarenesses that hopefully as scientists we're much more alerted to, and we'll be able to think about it in advance and really come at it from a much more kind of social behavioral health approach instead of just, but this is the science and it's so cool, how could you not want this?
Well, I'm going to inject a little opinion here. I think the public saw that prominent people, influential people, were saying they would not take a vaccine produced by President Trump. And then after the election, they suddenly embraced the vaccine. We saw a public official tell us we were risking our health recklessly if we attended a speech by the president, but not if we attended a protest for social justice. Then we were doing good things. So we saw contradictory statements that seemed to depend upon political allegiances and beliefs, and that hurt the confidence of people in the public health officials and the public health authorities. By the way, I'll just make a little joke here. I learned recently that the acting director of the NIH is Dr. L. Tabak. That's me. Okay. So I share the same name. I have a nephew named Louis Tabak. I said we should not take any responsibility for what's happened here. So let's go on from here. We should, I want to know what you think the public's expectations were at different stages and how the authorities and the experts could have helped the public make realistic expectations. Did the public think we would eradicate this disease entirely? What were the public's expectations? What expectations should we have communicated to the public over these last 2 years? So I think, what are the estimates now, Nafissa? Have 100 million people, Americans, been infected? 200 million? The virus has spread far and wide, has it not?
It has.
Would we have believed that 2 years ago if somebody had come out and said, we've got a virus, we've got a vaccine in the works, but 200 million of you are going to get sick anyway. Most of you will never know it. You'll be okay. What would have happened?
So I think for me, the public expectations, I don't know. And I think that's one of the things that I'm starting to learn as a leader that it's okay to not have all the answers. And so I don't know what the public's expectation. I think that people were concerned and wanted to know what to do to protect themselves, their loved ones, and so I think just guiding them through the process was really what our responsibility of as a health department is and was and will continue to do that. So for myself, I don't know what the expectation was, but I hope that we met their expectations, and I hope that they felt that they were given all the necessary tools to make the best decisions for themselves and their loved ones.
Okay, I promised each of you a final word, and I've talked too long. So, Christine, if you have some brief point that you think our audience should take away from this discussion, could you share that with us here?
Sure. I would just like to say that, I think the key is that we keep talking to one another, regardless of, whether we think that we're from the red part of the state or the blue part of the state or, the rainbow part of the state. The only way to work together is to keep communicating. And I think that is the central tenet of this conversation. Has been fantastic.
And Laura?
I would agree with Christine. We need to keep talking with each other, not at each other and not around each other, but with each other. I would encourage people also to broaden their sources of information, be willing to step outside their comfort zone, their 3 favorite websites or whatever, and look at deeper journalism about this, so that they will learn how to ask better questions and get the information that they need to make good decisions for themselves and their families. We get a little too comfortable with those same 3 favorite websites or newspapers or whatever, but there's a lot of information out there that can be helpful to us.
Okay, 20 seconds, Nafissa.
Open communication, be understanding. And I think that, always do your best to protect yourself and your loved ones from COVID-19 or any infectious diseases. I think that's important. And right now we're seeing the importance of taking care of your one's wellness. And so making sure that you prioritize your health and your well-being is so important.
Okay. Well, thank you all for a good conversation today. I take from this ending, we should be asking good questions, more questions. We should be talking to people who are unlike ourselves, and we should maybe get away from those 3 websites or that 1 newspaper and one website and 1 radio show that we listen to all the time. So good advice all along. And very interesting to learn how much expertise we have in our local community. I would have liked to learn more about our study of infectious disease at the University of Iowa and more about what a county public health director does. But unfortunately, my producers give us only 30 minutes. So thank you all for joining us. And thank you in the audience. Stay healthy and inform yourselves, make good decisions. Be responsible to yourselves, your coworkers, your family, your neighbors. Take care of yourselves. And see you next time on Ethical Perspectives on the News. So long. Bye-bye.